On this episode of the ASC Podcast with John Goehle, we discuss the latest news, the impact on ASCs of the ongoing drug shortages, recent state actions impacting ASCs, including price transparency initiatives, and in our focus segment, we discuss profitability challenges related to ongoing salary and other cost pressures, and interview triValence's Alex Pirrotta regarding supply chain costs.
Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. We'd like to thank our sponsor of this episode, triValence. triValence offers a comprehensive next-generation ASC solution that optimizes payment and supply chain performance, enabling actionable data insights. For more information about triValence, visit their website at trivalence.com. That's trivalence.com.
Welcome to episode 209 of the ASC Podcast with John Goehle for December 27th, 2023. We're recording from our studios in Spencerport, New York. This is Sue Cronkite, co-host of the ASC Podcast with John Goehle and Operations Manager for Ambulatory Healthcare Strategies. We would like to remind our listeners that the ASC regulatory environment is a rapidly evolving landscape, and the material presented in this episode is based on the most current information available as of the date of recording. As such, it is important to recognize that this information may be subject to change, and we advise all ASCs to stay up to date with the latest regulations and guidelines issued by their relevant regulatory bodies. Joining me today is John Goehle, the owner of Ambulatory Healthcare Strategies and one of the most respected experts in the ambulatory surgery industry. With over 30 years of experience, Mr. Goehle has authored over 10 books on the ASC industry and is a sought-after speaker on regulatory, accreditation, and finance issues.
So, Sue, you have some big news?
Yes. I have my fourth grandchild has arrived a few days ago, and it's Amy, my daughter Amy, who works with us. It's her first baby, so we've been busy around here.
That's right.
Snuggling.
We've had this script available for a while, and we just have finally been able to sneak down in between feedings here. But the new baby lives with us, and I got the news while I was on an airplane. That always interesting to see how text messages can come through even on an airplane. But it was great news, and we're so happy to welcome Millie to our family and to our home. She actually lives with us too. So, and she's one of many babies coming in the Ambulatory Healthcare Strategies group. I think we have two others coming. Well, we do. We have two others coming in the next 3 to 4 months. So
every 2 months we thought we'd space it.
That's right. We spaced it out.
Everybody planned it very well.
And with that challenge, we've been bringing more staffing on, and we mentioned this a couple episodes ago, but Katie Pearson has joined us on our staff here, and she's a great addition, a great friend of the podcast, and it's such a pleasure to have her join us here. She's very knowledgeable and now going to be, and she's actually going to be on the podcast a little bit over the next couple months too. And we had a great holiday. Obviously, having a new baby in the house is one great way to celebrate. But we hope all of you have been enjoying the holiday season also as we record this between Christmas and the New Year. You know, so this is the time of year when we start reflecting on everything that's been going on for the past year. As we finish up our 6th year on the podcast, we're going to have kind of a retrospective in our next episode, which we'll probably record in the next couple of days also. You know, a lot of financial challenges, I think it's fair to say, have been appearing with the ongoing inflationary pressures we have, the salary challenges that we have. So we thought we would talk about that as part of this episode today. So before we get to that, Sue, why don't we talk about some recent news?
An ECRA and ISMP report from October detailed the results of a survey conducted across different healthcare settings concerning drug shortages. 60% of respondents reported shortages involving single-use supplies, durable medical equipment, and more than 20 drugs in the previous 6 months. 86% of respondents reported having to ration or restrict the use of supplies, drugs, and equipment, such as rounding down on medication doses or even reusing single-use devices, which should never be done.
Right. I was just going to say, yeah.
Or extending the beyond use date, which you can look those up with the help of your pharmacist. And
as long as it's been,
the company has,
right, as long as the manufacturer
extended it. Yes.
Yeah.
To ensure safety, 84% of respondents reported increasing education of staff regarding safe dosing of alternative drugs or alternative supplies and equipment, which is really important because,
right.
you know, when you have a different form of the medication, just make sure you're always keeping your staff updated. Most respondents also reported regular meetings with pharmacy staff, and for ASCs, this would likely be your pharmacy consultant, and regular staff meetings about any shortages of medications or materials and, you know, how to handle that if you're changing dosages and that kind of thing. Almost 50% reported having to delay patient treatments due to supply issues. And I'll take this directly from the article. They kind of published a word of caution to address the shortages. Many hospitals and health systems are sourcing devices and other equipment from non-traditional suppliers since demand is outpacing the availability of functionally equivalent product from reliable manufacturers. ECRA's testing of medical supplies and personal protective equipment from non-traditional sources has revealed alarmingly poor performance. Tests of nearly 200 imported KN95 masks from 15 of the most popular non-traditional sources showed that 60 to 70% of masks did not filter the amount of aerosol particulate the manufacturers claimed. And testing of 34 models of disposable gowns without clearly advertised levels of protection revealed that 52% failed to even meet the Association for the Advancement of Medical Instrumentations, or AAMI's, standards of level 1 protection. And 50% of disposable gowns that claimed to meet a level of AAMI protection did not meet the standards described by AAMI. So for more information on managing drug shortages, visit the ISMP website, which we'll provide a link to. And for managing supply and device shortages, the ECRA website, which we'll also provide a link to.
There is so much to unpack from this, Sue. I in particular, and one thing that came out, and something that I've been very careful with, as I'm out and around, is just making sure that the staff of the staff of the surgery centers understand that just because we have a shortage doesn't mean that we can use these products past the expiration date unless, the manufacturer has extended that.
Yes.
And there's so many reasons for that. Regulatory, obviously you can get into a lot of trouble with that, but of course the efficacy of the drug is always a question. And of course, if you ever have a lawsuit, and the plaintiff finds out that you've used drugs that have expired, you're going to have some problems there. And another thing that I've noted is that sometimes I, as a surveyor, when I come in, will discover something that an anesthesiologist is doing or a physician is doing that the staff themselves do not know what's going on. And the anesthesiologist or the physicians think that they're doing a good thing by saving product or making sure that they provide the necessary drugs to the patients. But of course, we in administration, we in leadership positions within the organization have to protect that organization. So I think one takeaway I want to make sure we extend to all of our administrators and nurse managers out there is to keep an eye out for those situations that people might not readily admit to occurring in your organization.
And always work with your pharmacy consultant. If you're talking about medications, they might have some alternatives you hadn't thought of.
Right. Or be able to help you with sourcing, drugs. Or they could also be helping you to identify whether the manufacturer has extended the.
Yes, they've got all of that information.
And another takeaway from this, of course, is making sure that you make sure your staff is well aware of the rules there and that they can't extend or use drugs past their expiration date if somebody else in the organization has told them it's all right to do that.
Or reuse single-use devices or
correct.
Single-dose vials.
It was also interesting, they're talking about masks and I thought it was interesting. They mentioned the disposable gowns that didn't even meet a level 1 requirement. Sue, while I've been visiting many of the state associations, we've been noticing some trends in state legislative activities. And I know ASCA is very much involved in this, and our good friend Stephen Albrecht, who we work with very closely and who is a great resource for state associations, wrote an article in a recent ASCA News Digest, which talked about some of those trends. We just want to kind of mention some of those things in general so that you keep a very close eye out for it. And we do want to, thank ASCA for the hard work that they have been doing on behalf of the state associations and, trying to bring these initiatives to light nationally so other state associations can be prepared for it. One of the areas that there's been quite a bit of work in, especially 6 states in 2023, Colorado, Connecticut, Maine, Massachusetts, North Carolina, Texas, considered facility fee proposals that, had they been enacted as they were introduced into the legislatures, would have prohibited ASCs from charging facility fees, effectively killing the ASCs in their states. And this is one of the reasons that we really encourage our ambulatory surgery centers to join their state association to advocate on behalf of the interests of the ASC. So certainly in those states, as well as all the states in the country, make sure that you are a member of the state association there. Price transparency has also been a major issue, and 9 states in the last year have been looking into this. Colorado, Florida, Illinois, Iowa, Massachusetts, Minnesota, New Jersey, North Carolina, and Texas all considered legislation that would have imposed new price transparency requirements on ASCs, meaning that they would have to disclose their prices in a public manner. Price estimate legislation in Colorado and itemized billing requirements in Texas were both enacted this year. So, again, another reason for you to become a member of your state association to protect your interests there. Certificate of need rules are continuing to change in various states. Major developments occurred in North and South Carolina, where both states enacted significant reforms to their programs. So, big takeaway here is that in North Carolina, there is a new class of CON-exempt ambulatory surgery centers called Qualified Urban Ambulatory Surgical Facilities. So reach out to your state association if you're looking to build a ambulatory surgery center in an urban area in North Carolina. South Carolina did adopt much more extensive reforms, fully repealing the CON requirements for all facility types except nursing homes and the Medical University of South Carolina. So that was a major win, of course, for the industry. And, of course, surgical smoke has been a major initiative. AORN has been advocating this across the country. 11 states considered 20 pieces of legislation. They were California, Florida, Louisiana, Massachusetts, Missouri, New Jersey, North Carolina, Ohio, Pennsylvania, Texas, and West Virginia. And 5 of those states did enact their legislation: California, Louisiana, Missouri, New Jersey, and Ohio. As with past surgical smoke evacuation requirements, these new laws do require ambulatory surgery centers to mitigate the exposure to surgical smoke. I think this is a national trend, Sue. I think this is something that even if your state has not enacted it yet, you really need to be looking into it and being prepared for its eventuality. And it certainly is the right thing to do. If you want more information, we'll give you a reference to ASCA, the ASC Association. And again, please join ASCA. They do an incredible job on behalf of all of our ambulatory surgery centers. And I want to thank Stephen Albrecht for a great article about what's going on there. And so there was an interesting article in Beckers about Ozempic and its impact on healthcare. And I found it kind of amusing. Do you want to walk through it?
So we've talked about Ozempic and other GLP-1 drugs, and their use has quadrupled in the past 3 years. So it's really something to think about. We talked previously about the need to take these medications into consideration when you're planning surgery and doing a history on your patients due to the delayed gastric emptying that's caused by these medications. And so, it's important to look into what the anesthesia groups are saying. They usually want a longer NPO time, but, there are differing opinions on that. But that's important to take into consideration.
Just to make sure that the patient's stomach is completely empty. Yeah.
Yeah. And there is now a lot of speculation on how these medications are going to affect surgery rates in the future. So a number of plastic surgeries are increasing, especially that skin removal due to the rapid weight loss. And according to Beckers Spine review, there may be a big jump in orthopedic cases, such as total joint replacements, as the patients lose enough weight to safely have surgery, as their BMI comes more into line with what is safe. However, in the long term, fewer surgeries may be needed due to people becoming thinner and healthier before that joint damage occurs. So this is a trend to watch. We're not quite sure how it's going to all play out.
Yeah, it's kind of interesting, the kind of good news, bad news. But I think our major takeaway here is, of course, is that you should be asking questions about Ozempic and the other GLP-1 drugs.
Definitely.
Just to make sure that, and your anesthesiologist already know about this, and they probably approach you. But if not, put it on your next quality improvement and medical executive meeting discussion, especially if you have general anesthesia or deep anesthesia. But I think it is encouraging. Obviously not necessarily great for our industry if the number of surgeries goes down, but it is good for our nation to have healthier people. So let's take a short break, and when we come back, we're going to talk about the cost pressures that ambulatory surgery centers are having now.
Do you work long hours at your ASC, ordering from multiple vendors or managing back orders? Do you manually track POs and invoices? Do you need help sifting through paper to find payment discrepancies? Most ASCs are understaffed, overworked, and wear multiple hats, which leads to burnout. triValence launched an intuitive procurement-to-payment solution that optimizes your ASC's performance and removes the frustration from daily tasks, allowing for a happier, more productive staff. The triValence solution streamlines the disjointed supply chain in your busy surgery center, from ordering supplies to managing your purchase orders and invoices to making payments. The platform provides a robust dashboard with actionable reporting and lets you track your spending down to the penny. Visit trivalence.com to schedule a demo or learn more about this all-in-one solution. That's trivalence.com.
As we come to the end of 2023, I thought it would be interesting to kind of reflect back on some of the cost pressures that we have, the profitability pressures that we have in our organizations. And we've seen this certainly with our own clients and certainly in the market. We know that the consumer price index has gone up about 3.9%. That's as of the November numbers. And the hospital market basket for hospitals is running between 4 and 5%. However, our reimbursement is certainly not keeping pace. Medicare, for example, has increased our reimbursement for 2024 by 3.1%, a full 1% lower than the hospital market basket. Now, the hospital market basket is the closest cost index that we have for our industry, but it is still different because, of course, of the outpatient costs that we have. But Sue, you saw an article in OR Manager, didn't you, about RN salaries? Did you want to talk a little bit about that?
Yeah, so the October 12th, 2023 issue of OR Manager, and we will provide a link, mentioned that RNs are expected to see a big salary bump by 2033. And of course, this is due to the nursing demand. So according to the article, RNs made around $33.13 in hourly earnings in 2013. And of course, this is on average and probably based on hospital pay.
Right.
And it rose to $45.49 in 2023. And that is expected to rise to $74.09 in 2033.
So those are pretty big increases. That's about a $12 increase over the past 10 years, which is almost a third, or almost 30, about 30%. And of course, going up to $74 is another $30 increase. Mm-hmm. So I think we have to be very careful about keeping our staffing at good levels, keeping up with the salary demands of our nurses.
And of course, they did mention that the U.S. Bureau of Labor Statistics said that registered nursing is still one of the fastest growing fields in the country. And we're expected to need an additional 193,000 nurses per year over the next 10 years. And that this is interesting, that nursing school programs have declined for the first time in 20 years. So it's not getting better anytime soon.
Right. And the report also noted that the primary driver for increasing nursing salaries is the demand for the job and the number of qualified workers, which is continuing to decline. And of course, you already saw the statistic for the number that we need. So from a salary perspective, I think it's important for you to really kind of keep your current staff happy. Of course, it costs a lot of money to try to find new staff. And the easiest way to avoid a problem in the first place is make sure your staff don't leave. So I think you have to do some market research, make sure that your salaries are in line with what's going on in the community. Of course, there are certain advantages of working in a surgery center, but some of those advantages are disappearing. For example, working longer hours, working on weekends. Unfortunately, surgery centers have had to start working longer hours and have added Saturdays and Sundays in some cases. So if you are able to avoid that, certainly use that as part of your marketing, or recognize you're going to have to pay more money if your organization does have to extend hours.
But you're still not doing overnights, which most new nurses in a hospital have to do their share of overnights.
And they're not taking call.
So there is you don't have to take call. And just making people feel like part of your family almost. If people become loyal to you, that's going to, have a huge effect. And I think especially younger workers coming in, focus more on their work-life balance, kind of, and other factors besides just salary, although obviously you have to be somewhat competitive with the salary, but really pay attention to those other benefits that you can provide as a smaller place.
Right, both the monetary benefits such as healthcare, insurance, if you have to, again, when you worked in the hospital, you had to pay parking costs. Hopefully your surgery center doesn't have that. But all of those things are things that you need to be taken into consideration and using as a part of your marketing tool. But definitely check your benefits, because often hospitals do have nice benefit programs, and you might find yourself having to match some of those programs out there. I think, to your point, Sue, one of the big advantages of working in a surgery center is the non-institutional look and the feel that we have. So as much as possible, make sure that you make your place more like a family environment for your staff. And also, to your point, younger employees, when they go to a hospital, they're going to be part of a big cog. But in a surgery center, they're going to get an awful lot more personal one-on-one attention. And certainly you should be talking about that also, and making sure that your organization does provide that to your newer employees. We've mentioned this before. In the past, we've always encouraged surgery centers to only hire experienced nurses. We no longer have that luxury now, and we have to be prepared, to train people fresh out of school. And, our dear friend Lori Rodricks, she's always mentioned that the nice thing about that is that you train them right the first time. They don't have to take somebody from perhaps a hospital or has worked in a hospital environment for a long period of time and, acclimate them to a new environment. When you have a new employee, somebody that's fresher out of school or recent graduate, you can train them your way right from the very beginning. They won't pick up those bad habits that they often get from those hospitals.
And I think most people go into nursing because they do want to be that patient advocate. They want to give really good patient care. And I know from personal experience just recently with the delivery of my granddaughter and just other stories I've heard recently, I don't think that nurses always are able to feel they can provide as good of care in these large hospitals.
Right.
And so I think maybe pointing that out as a benefit, that you're directly involved in maybe decision making and making people feel like they really can feel good about their job when they go home and know they've given really good care. Because that makes a big difference in burnout rates and everything else if they feel like they're doing the right thing, and they may not be able to do that always in a larger, more industrial setting.
Correct. And I think we also need to recognize that it's not just nurses that are in high demand. Recently, I spoke to a center about their staffing challenges, one of our clients, and they said, something, John, we don't have a problem recruiting nurses right now. Their implication is that, of course, they were very lucky at the present time. But they did indicate that they're having some challenges with back office staff, business office staff in particular, and that the low unemployment rate is affecting the rates of pay in those areas, and they're finding employees jumping to higher paying positions, sometimes even outside of healthcare. So again, you're going to have to watch all of those positions, not just the nursing staff we've spent quite a bit of time talking about, but recognize your other staff are also finding themselves in a very highly competitive environment. And of course, it's not just salaries expenses that are causing problems, as we mentioned earlier. And to that end, I had an opportunity to talk to Alex Pirrotta with triValence, one of our sponsors, about the impact of inflation on other costs in the surgery center, as well as what an organization might be able to do in order to be able to meet those challenges. In particular, we talked about finding efficiencies in your organization, as well as, of course, making sure that you keep your costs low. So let's listen to that interview now. So I'm here with Alex Pirrotta from triValence, and we're recording just before Christmas, and I'm out of town. I'm not able to record in the studio, so we apologize to our audience for any recording issues here. But Alex, it's great to have you. Happy holidays.
Happy holidays, John. Great to be on, and appreciate having some more conversations here, and looking forward to it.
Thank you. And your last interview was very well received, and we thought we'd bring you back to, as we come to the end of the year, I thought it would be a good time to kind of talk about those things that we should be talking about all year round, but it comes to mind as we're closing out our financial year. We know, Alex, of course, that inflation is hitting us hard as citizens, as well as companies, healthcare in particular. And unfortunately, it is a reality that our revenue stream in the healthcare industry is just not keeping pace with that inflation. And salaries are taking a big chunk of our money out. We know that about 25 to 30% of the revenue that we have goes toward paying the salaries, and that's taken perhaps even a larger chunk of our budget now. And we can't control the salaries cost, unfortunately, because we need those employees. Without the employees, we can't do our cases. And, we're having challenges with recruiting staff. We're having challenges because we're competing with other providers. And of course, we got to keep our staff happy so they don't leave us. So that leaves us, as we try to balance the books, as we try to, keep our profitability at least where it is now, and perhaps even increasing it, kind of push to find ways to cut costs. And Alex, you and I, before we started recording, we're joking about my comment being, we got to find ways to cut costs. And of course, I've been saying that for 3 some odd years.
Right. It's an interesting time to be running a business, right? You have your top line staying relatively flat, your costs going up, and you got to figure out how you're gonna survive and maintain financial stability. And so, to your point, the next place you always look is, how do you cut costs, and how do you reduce things? And obviously your salaries are not going to change significantly, right? You can't really make cuts there. They're incredibly important people and doing great work, and you got to find that other 70-ish% of your cost base of your revenue that you got to go cut costs on.
Right. And I think one of my concerns, having been an administrator myself for a good 17 years and then working with administrators, is sometimes, let's face it, it's a tough job to be an administrator, business office manager, or nurse manager, for that matter. All three of those positions, or whatever positions you have in your organization, are responsible ultimately for the cost. But we have so many other duties, and even more so after the pandemic, as our staffing gets tighter and our responsibilities as ASC leaders get more broad, that there are certain things that we let go. And I'm afraid that one of those might be keeping an eye on costs. I mean, I think we're always conscious about costs, but we're not always looking deep into what's going on. We might be complacent about certain of our costs. So can you address that a little bit, as how do we avoid that complacency? What are some of the areas that we should be making sure we look at all the time, and especially annually?
Yeah, absolutely. I think in this environment, right, like one, you're obviously cost cutting and looking for efficiencies there is one. The other is thinking about how your staff is working and operating day to day so that you can maximize, the patient care. You can maximize your team focus on value added activities instead of administration. And, just from a pure, making sure you're getting the right prices sort of perspective and kind of keeping an eye on that. I always think of it as, it's not just cost cutting, right? Like, it can be even further into more of a strategic approach towards, financial stability, quality care, and just competitiveness all around. And, there's many ways to approach this, right? I think some of the simplest ways are, just talking to your suppliers, right? Like, identifying those key suppliers you have and just understanding, like, are you getting the most competitive pricing? Should you be calling another competitive supplier or vendor? Should you just be, opening up those lines of communication? can do a couple different things. One, you might actually just immediately get some savings because they want to partner with you and continue that relationship. Or you're going to hold them accountable if you find another vendor and say, hey, can you match this pricing over here? But I think by regularly just sort of evaluating your vendors, it can establish a stronger relationship. You can foster more collaboration. There's a partnership, leads to better service, more reliability, better responsiveness. You're just kind of working as a team together, and just opening up the lines of communication. I think that's the big one, is just having those conversations.
You bring up an interesting point. And just personally, this last week, I called up my friends over at OnStar and said, I'm canceling your service because, first of all, I don't think I need it anymore because, with cell phones and all. But it was amazing to me because they offered to decrease my costs by 3/4. I mean, just calling them on the phone. And I think to your point, just do it with everybody. Just say, I'm looking at other vendors right now. What can you do for me?
Absolutely. And if you think about it from the flip side, so, where the world that I've lived in for a while is they think of it in terms of that cost to acquire a new customer, right? And it's actually less expensive to give a future discount or on current services than trying to go find a new customer to replace the volume of transactions that you. So in OnStar's case, they kind of look at that and they have some sort of formula behind the scenes, right? And they say, you know what, it's going to cost us X dollars to go find another John. So, well, let's see if we can just get him keep him on board for a little bit longer with a lower price. And suppliers, might not think exactly in that framework, but similarly, right? And they realize that.
Yeah, especially products, it's difficult because there is a cost associated with it. But, like a service like that's pretty much, it doesn't cost them any more for additional clients or, people. But that's a very good point, is you need to kind of separate those out. Look for those situations in which you know that their cost of adding you is not that high and the cost of losing you is even higher.
Exactly. Yeah. And it's also, I think everyone approaches this as entirely cost cutting and trying to find the lowest price. And I don't always think that's even the best approach, right? You want to kind of strike this balance of cost effectiveness and quality, right? Because at the end of the day, you could find the lowest cost product, but the quality couldn't be there. And you want to have a high standards of care and, all of that. So it becomes a bit of a balancing act as well. But I still think opening up the communication, talking to your vendors, talking to your suppliers is kind of the key sort of number one step to approach.
Now, a lot of our centers, that our audience is a mix of people that come from very large organizations and very small organizations. So, our average listener, well, I don't know that we have an average listener, but we've got listeners who are actually doing the purchasing because there's nobody else to do it, as well as people that are, managing large surgery centers that might have multiple people that are doing the purchasing. It's a little bit easier for us to tell our listener that's making those purchasing decisions to keep an eye out for these things. But what advice do you have for those that are supervising individuals that are doing the actual purchasing?
Yeah, I think in that case, it's a similar answer, I think, in terms of communication. Ask, what are you doing to talk to your vendors? Like, what cadence are you speaking with the vendors and your suppliers to understand, are we competitive? I think that's the best way to do it. It's all about communication and just kind of striking that right balance of, quality and cost effectiveness. But you're right. Like, I think your listeners are probably across the board. You have somebody who's just filling in and saying, this isn't my entire job. This is 10% of my job. Like, I don't have time to go call all my vendors every week and start negotiating pricing. But it can even be small steps, right? It doesn't necessarily need to be, I'm going to think of it like this massive project and I'm going to call every vendor. And it's like, start with one, right? You can start with one or start with certain supplies, specific supplies that you purchase, and think about, well, do I need to get it from this particular vendor or this particular supplier? Is there another option to consider? And if you look at it from that perspective, it's not as daunting of a task, right? It's not like I need to look across my entire supply chain and figure things out. It's pick it off one by one. Now, and to your point, the range of folks that might be listening, somebody who's managing a whole supply chain team is probably thinking about this day to day, right? And actively negotiating on a more regular cadence, and somebody who's spending 10% of their job on this, they can't, right? They have too much other things to do.
Well, and of course, our purchasing people, if we're not that purchaser, we need to supervise them. We need to keep an eye on them, and more importantly, need to make sure that they have the proper tools. Maybe what I found over time is that sometimes the communication between the GPOs, the group purchasing organizations, and the purchaser might have broken down, or it's just not to the level it might have been at the very beginning of that relationship with the GPO. But just making sure that you as a leader are involved periodically with that GPO discussion, and maybe talking to the GPO to make sure that your purchasing people are indeed communicating with them on a regular basis, especially when they're purchasing something new.
Yeah, absolutely. It comes down to communication again. You set up these regular cadence check-ins. Maybe it's every 6 months, every quarter, whatever is the right kind of cadence for checking in with your vendors, but it's worth it.
So let's talk a little bit about, some of the things that we might have a little bit more control over. I think we understand the importance of communicating and making sure that we're buying, supplies at a good price and constantly looking at that. But there's other things that we can be doing in our organization to kind of behind the scenes in order to improve efficiencies, for example. Do you want to talk about that a little bit? Especially, I think that whole purchasing cycle is one of those areas that's undergoing incredible changes right now, not just in healthcare, but across the board in companies.
Yeah, I agree. I think lots of changes across the board with new technologies coming together, and the entire industry has really historically just been pen and paper. Everything is, write an order, send it in, send an email. It's all very manual. And then maybe it started to migrate a little bit more towards e-commerce. And then you have somebody who's purchasing for an ASC, and they probably have maybe 10, 15, 20 of like their top kind of suppliers. And they have 10 or 15 tabs open on their browser every day, like trying to go in and order. It's a mess, right? Because it's a nightmare. It's like, did I order that one? Did I not? Like, where am I? What's my stock level like? And it just becomes this kind of cobweb of a process. And now there are solutions out there. Of course, I can plug triValence, but we can kind of centralize all of that, right? So you can go to one place, have a shopping cart type experience. You know what you're ordering that day, you know what you're ordering that week, and you can look and you can, all of this gets sent electronically. So there's a simpler way to do this. And outside of the actual purchasing and submitting a purchase order, oftentimes what people maybe think less about, they think of that upfront as being the most administrative work, but there's so many other steps after that. Like, you got to make sure you received your goods, you got to make sure that you're getting the right pricing, and then you ultimately have to go pay that bill. And being able to do that in one centralized view and one centralized hub is just invaluable. You can reduce errors, you can speed up time, like we mentioned earlier. Another way to think about efficiency with using people is people's time, right? Like, if 30% of your revenue is spent on people, well, make sure you're maximizing that time. And part of that is not passing paper back and forth, right? It's using the tools that are available to speed up the process and ensure that people are focused on the value-added activities.
Yeah, it's interesting you should bring that up, because I just visited a center yesterday, and I was asking about staffing. And when I'm talking to the clinical staff, they said, actually, we're okay right now. We finally got enough of our clinical staff on board. Now, they're very lucky, I think, and they're very fortunate right now, and that might just be a temporary situation. But then the business office manager said, something, that's not my situation. I cannot hire people in the business office that I need in order to be able to accomplish all my work. So to your point, the lack of staff, the lack of staffing, or the challenges we have in hiring staff in the business office is indeed a problem, which means that we got to find ways to more efficiently to address that.
Yeah, I agree. And I think hiring is difficult, and retention is just as difficult, if not harder. And what I've always thought of is being able to provide people the right tools to be able to do their job effectively and efficiently is going to keep them longer, right? Like, if somebody is pushing paper back and forth all day and they're getting overwhelmed in that cobweb of ordering process that I was talking about, they're not going to be super happy with that after a while, right? They're eventually going to get burnt out and say, I have too much to do, and this is only supposed to be 10% of my job, and it's become 30% of my job. Now I don't have time for the other stuff that I actually liked doing, and even providing those tools in the business office can help retain employees, and I think there's a huge value add there.
Well, so it brings up an interesting topic, and again, gets a little bit back to the purchasing person too. But in the past, the old model, when I was an administrator, good 20 some odd years ago, I was constantly being bombarded with people coming to my office uninvited, trying to sell me products, or distributors, coming in and wanting to meet with me regularly to talk about their new products and things like that. Is that the model anymore? I mean, what do you think the trend is in that area? How are we purchasing things now? Is that a viable model, and should we even be accepting people like that coming into our office?
Yeah, I mean, I think it depends, right? It's all situational at the end of the day. I think it is moving away from that model to some degree, and really, focusing more towards on, sales that are not necessarily in person as often, but there are always going to be that level of in-person interaction, and keeping up with your local reps and your local folks. But the actual placing of the order tends to now be, behind the scenes, right? They may have came in once a week and said, "Hey, what would you like to order?" And like, let me go fulfill that order for you, right? Or let me pull it out of my trunk, like whatever it is, right? But now it's become more, they're looking at the, folks coming in are looking to sell on new initiatives, either new, trying to gain your business from another supplier, or trying to sell new things that are coming down the pipe. And so it's just kind of shifted a little bit, right? It used to be maybe more in person, let's go place your order today. But now I think all of that happens electronically, hopefully for the most part. But electronically could be the cobweb that I mentioned before, right? A lot of it still sits in that I send an email to this vendor, I order through their website on this vendor, and this vendor I call it in, or I fax it. Like, it can go in through any channel. And
Right.
I think one of the big efficiencies with technology that we can use that has been more apparent maybe in other industries for a long time, but you can centralize all of this. So
as well as be able to compare prices. I mean, I always use, whenever I'm talking to you, I always use the Amazon model, because that's similar to what triValence is doing, though. I mean, it's different mechanism, but I can compare prices pretty easily when I'm looking to buy whatever, even food products now, very easily on the computer. I mean, even with something like Instacart, for example, I can compare different products that could be delivered to my home, directly. And we're all embracing that type of technology now. We expect it at home. We use it at home. Why shouldn't we be using it here, right?
Exactly. And that type of, ease of use is things that as a consumer we see every day. But in some of our work lives, we don't see it. And it's a little bit more challenging. And, that's where I think triValence is making huge strides, is, centralizing the purchasing function and allowing folks to more strategically look at purchasing. And then also, bring up even the payment side into the more consumer-like world, as, you click a button and your vendor gets paid. It's not, okay, now I have to go take the invoice and enter it into QuickBooks, and then maybe I'm using Bill.com, or maybe I'm using QuickBooks. Maybe I print a paper check and then I have to go get it signed. Like, there's a whole process that folks are doing behind the scenes there. But what we're trying to do is try to bring some of that consumer-like feel of technology into your day-to-day, so that, you click a button and it's done.
So let's compare the old way when you generate a check. Just talk a little bit about how we used to do it and how inefficient that can be. Because I mean, I know for a fact a lot of surgery centers are still cutting a lot of checks. And even very large organizations are doing this. And I think that they hesitate to move away from that because they feel that that check is that control that they have, having somebody physically sign that check. But we can replace that old inefficient paper and pen type system with technology now. So can you compare the old way to the new way, and how much, I don't know, if you can even estimate how much time, you probably have studied that, how much time you can save?
Yeah, I think there's a lot of time you can save. I mean, I remember earlier in my career, one of my first jobs was really in accounts payable. So I know this well, where we're an organization that printed checks. We probably printed, I don't know, 200 to 300 checks a week in a weekly check run. And every single one of those checks had to go get, signed, right? And we had ways to speed up the process, but every single one of those had to get physically printed. And think about the time just waiting for them to print. But all these issues, your printer didn't work, something got jammed, and you have to redo the check. It's like it can be a nightmare. And then you have to go track down the person who actually has to go authorize those checks, put them in an envelope, and get them out the door. And it's a day or more of work to get all that done. And you can replicate a similar process and not give up the control, but use electronic tools to do it. And it'll save you a ton of time. So, for example, you don't have to print the check, but you can present the batch and or the individual payment you're going to send to the approver. They're just going to see it electronically on their screen. They can look at the image of the invoice. They can look at the detail of the pricing and whatever they would normally look at when they sign the check, except they can just see it on their computer screen, click a button, right? And it's done. There's no printing of the check. There's no mailing it, and it just goes and gets paid to the vendor. Now, it could be paid by electronic payment by ACH. It could be paid by a credit card. It could be paid by a paper check. All depends on the supplier and kind of how things are set up. But there's a way to replicate that process without giving up the control. And what I always thought was, for myself, and when I converted from paper to electronic, was most appealing was that you have a full audit trail, right? You know what happened. You know who clicked the pay button. You know when they did it. There's not this issue of, wait, we paid this 6 months ago, and I don't remember signing that check. And that kind of all goes away. You have it's gone through your entire workflow, and I think that's the important piece is figuring out what the workflow needs to be so that you don't give up that control and you actually just have better control.
Right. Well, and I think back in my days when I had to sign these checks, I'd get this huge stack of accounts payable. I'd have the check at the top. I'd have the, purchase order. I'd have the receiving document. I'd have the invoice. I would check to make sure that my accounts payable clerk had done all of those things. And periodically, I would have to double check to make sure that indeed that individual is doing it properly. But I have this huge stack of paper that took me forever to go through. If I could look at it on and of course I had to do it in an office, as opposed to perhaps even remotely. If I out sick for the day or if I'm working remotely for the day, couldn't do that in the old way. But the modern system you've just created, or so many of our, let's face it, so many of our administrators, nurse managers now, business office managers, they don't have time during the day to do some of these basic functions. They might be doing that on a weekend, unfortunately. Not that that's right, but the electronic method you've just described is something that probably can be done anywhere.
Yeah, and it can also resolve errors faster, and you can ensure accuracy. And so, I always think about the process you just described is basically you're reconciling data, right? You're saying, does the price match? Did we receive it? All of that sort of thing. Computers are really good at doing that sort of stuff. And so when you can just put the technology in place to do that for you, you just got to make sure that conceptually everything is working the way you want it to work throughout the workflow. But like, for example, triValence can work through that matching process that you described all automatically and systematically. So you're not looking through 4 or 5 pieces of paper to go check it off. It's, we've already done all that work. And if there are exceptions, we'll highlight them and say, hey, this is a little off. You should go look at this one. That way, out of that batch you looked at, maybe there was one that was a little off, but you didn't have to go searching for it. We just say, here's the one to go look at. In that way, instead of spending, I'm sure, hours of time, you could spend minutes.
Right. And just don't forget about the paper trail that you've got there also, handling all that paper, scanning that paper into the computer if that's what you're doing, just filing all that paper, manually is an awful lot of time. The more I think about this, the more I think about how many man hours you could save just by physically handling that paper that you've got and getting rid of it eventually, storing it, sending it off to a storage location, for the so many years that you need in order to keep it for, accounting purposes. You're right. There's just such a time savings here. And not just the time, as you were saying, I think that's a better control because it reduces the amount of possible human error that could come into that system.
Exactly. So lots of ways to.
So talk a little bit about how we can integrate that with our accounting systems. There aren't a lot of accounting systems out there anymore, that people work with, and I perceive right now that the accounting system integration is not where I want it to be in the future. So maybe you can talk a little bit about where you see that occurring and how it needs to occur in the future.
Yeah, definitely. I think the integrations between third-party systems similar to triValence or any other and the accounting systems have just gotten so much better over time that this stuff is become a little bit more standard, right? And to your point, there's not 1,000 different accounting systems out there that people are using. There's a concentration, right? Like you might be using a larger ERP if you're a larger organization, but generally you're probably using QuickBooks or some version of a bookkeeping system like that. And integrating with a triValence or a product like that, it allows you to sort of maximize the value you can get out of a QuickBooks, right? Because you can sort of get your best-in-class procurement and payment system that then just feeds back into your general ledger, which will have your full picture of financial reporting, right? And so, personally, when I've worked in different organizations, I have always built a sort of technology stack that is exactly like that, where it's centralized around an accounting system, but you have 4 to 5 different peripheral systems that are best in class that are going to get you the most value that just feed into one centralized accounting system for your consolidated reporting. But the way that integrations I think are incredibly helpful is it reduces any double entry, right? You don't have to enter something in 2 systems. And I think the biggest value add is if you're even like if you start from the beginning of getting an invoice and if you get that invoice electronically, it can go into a system like triValence. It can be recognized and sort of automated and approved through a workflow, and then all of the information is then just pushed back to your QuickBooks or accounting system so that you don't have to do anything in between. It all is electronically. You looked at the screen, it followed the workflow, it automated the matching, everything's correct. You click pay, and everything kind of goes right to your accounting system. So when you go to run your monthly reports and kind of look at your P&Ls, it's there. You don't have to go searching for missing transactions.
And that kind of leads us into the kind of last topic here, which is just pure cash management. So we talked about ways to decrease our costs and how to deal with, keeping our expenses low, negotiating the best terms, improving efficiency of all of our staff, including the business office staff. But the last part is just keeping our cash as long as possible. And, of course, we're not talking here about revenue cycle, but making sure at the very least that our revenue is coming in faster than our expenses are going out. So talk a little bit about how modern systems can help us with managing our cash balances.
Yeah, absolutely. I think cash management overall is I think of it in the terms of working capital. It's both sides, right? It's how fast can you get your cash in and how slow can you pay your cash out in trying to maximize the time in between. And I think the nice thing about using a system like triValence is that we give you insight into your cash balance at any given point in time, right? We have connections to a bank account, so we can tell you before you go release these payments, you can say, oh, this is my cash balance today, right? You don't have to go log in again and go look at your bank or, think through how many open checks do I have? Like, where am I with that? Like if it's everything in one centralized place, all of that becomes much easier in terms of forecasting and understanding where you are today and where you'll be tomorrow. And I think, just from a pure negotiation standpoint, with your suppliers and vendors, we were talking about that before, is, one thing to really focus on, I always think about is, payment terms, right? Oftentimes if you get signed up with a new supplier, a new vendor, they might just give you their standard terms. Maybe it's due on receipt, maybe it's 15 days, maybe it's 30 days. But what I've always found really helpful is working with those vendors and just negotiating payment schedules that align as close as possible to that, either procedure delivery or cash collection times, and just really minimize that time between when you're paying your suppliers and when you're receiving that cash. And, oftentimes you can work with your suppliers, explain the issue. Hey, I'm not getting paid for 6 months, but I have to pay you tomorrow. What can we do to make this work? And, oftentimes they're willing to work with you, right? They're going to be your partner. They want to be in it for the long term. And these are ways that suppliers will help maintain your business, right? When we were talking about before, talking with your vendors around pricing and things like that, The other side that's also part of that equation is how long are they allowing you to pay, right? And you might have one that's giving you a better price, but you have to pay them in 15 days versus another who's giving you maybe a slightly higher price, but they'll give you 75-day payment terms. And it's like, well, you have to weigh that value to your organization of having that cash for longer.
Yeah, actually, I really want to emphasize that is that part of your negotiation. Again, a lot of the people that are listening to us are probably not as educated in finance and managing finances as somebody like myself and yourself, who, we were trained in that way. So negotiating lower prices and faster payment terms is a very common thing in high finance. If they want to get paid sooner, if your vendor wants to get paid sooner, then just, you should be saying, hey, I'd be glad to do that, if you give me a 2% discount, for example, if I pay you within 15 days.
Yep, exactly. And that's another way that folks go after price discounting is understanding, are there any dynamic discounting options? Like, are there early pay options? Are there anything that you as the ASC can control in terms of that pricing, right? Like, some suppliers may give you 75-day payment terms, but if you pay them, within 15 or 30 days, maybe they'll give you a 1%, 2% discount. And if that's the case, then you can kind of decide at when you're coming up on those payments coming due, is it worth the discount today for me to go pay them in 15 days, or do I want to hold on to this cash for a little bit longer? And you kind of get to make that decision and ultimately control your destiny to some degree of whether your pricing is going to come down or whether you're holding on to the cash is going to come down.
Yeah, actually, that brings up a very good point. One of my passions is, financial forecasting, looking at your financial situation. Again, it really gets down to what you've been talking about, Alex. In the old days, last year, we have a challenge in doing this financial forecasting because we're pulling information from a lot of different places. But the more centralized we have our systems, the more information we have in as few systems as possible, we can drop that into financial forecasting tools to be able to determine, whether we can afford to to pay faster if we're going to get a good discount. What's that bottom line impact going to be? There and the newer tools and AI, for example, artificial intelligence, can provide us that type of information that we can use to make some of those determinations. But what do you think about the importance of financial forecasting, for organizations today?
Yeah, it's critical, right? You got to keep an eye on this for and just making sure that your cash flows are, you're anticipating your future cash needs. I think, there's sort of like two components, I think, when folks as operators think about their cash, and one is people cost, right? And generally that's somewhat fixed, right? Like, it's pretty consistent month to month, week to week, unless you're making changes with your people. But generally speaking, that's somewhat fixed. But you have this variable component, which is everything else. And so those are the ones that are harder to keep an eye on and harder to track. But again, using a centralized hub, if you will, where all of your purchasing and all of your payments are coming through, you get a better insight into, well, what's coming due next week, what's coming due next month, and what do I need to plan for? And so to your point, depending on how granular folks are forecasting, right? You might have larger organizations who are looking at rolling kind of 13-week cash flow forecasts that are very, very granular down to the the supplier. And then you might have other organizations that don't go quite as deep as that and just kind of say, I need to maintain X dollars because I know my next week, my next month looks like this financial picture, and it's maybe less detailed. But having everything together is the only way that you're going to be able to predict the future, right? You can't just look at 4 different systems all the time and eyeball it, right? You got to bring it all in one spot and use the past to predict the future.
Yeah, and I'll just put a push in because this is, again, something that you don't necessarily need to do in-house. There are organizations such as ours that can do financial forecasting for you. But in order to be able to do that efficiently, of course, they've got to have access to great information that comes off of computer systems, rather than asking your staff to be able to pull that information together and then doing that, double entry, as you said, to be able to gather that information. We are definitely heading in that direction. We're not there yet, though, completely, aren't we? I mean, we still got some work to do, and and we've got triValence out there that's doing a great job on pulling it all together. But we need to make sure that we are at the leading edge of this type of technology, because it's truly something that we need in order to improve our efficiency.
That's right. Especially in an inflationary environment where you have, your top line staying stagnant and not moving a whole lot, and your costs going up. You gotta be able to have, really clear visibility and accurate forecasting to understand what you can do today and how's that going to impact tomorrow.
Alex, I really appreciate this. You're a great sponsor of our podcast. We appreciate the support, and we appreciate all this great information that will hopefully help all of our listeners to look for ways to become more efficient and to keep their costs low.
Thanks, John. Always great to connect, and hope you have a great holiday.
Thanks. You too.
In this segment, we provide an update on upcoming topics for the podcast, our upcoming virtual conferences, and upcoming speaking engagements for John and his staff, and other events in the ASC industry.
ASCA 2024 is coming up. It'll be at the Gaylord Palms Resort and Convention Center in Orlando, Florida, April 17th through the 20th, 2024, and I think I'm going to be doing 2 sessions there.
And the Georgia Society of ASCs and South Carolina ASC Association's joint semi-annual conference and trade show is February 22nd to the 23rd in Atlanta, Georgia, at the Westin Atlanta Perimeter North, and on August 15th and 16th, 2024, in Hilton Head, South Carolina, at the Marriott Hilton Head Resort and Spa.
And the Gulf States Conference is going to be June 11th through the 13th. In Biloxi, Mississippi, at the Beau Rivage, I hope I pronounced that properly, Resort and Casino.
The Florida Society of Ambulatory Surgical Centers Quality and Risk Management Conference is April 4th and 5th, 2024, in Daytona Beach, Florida, at the Hilton Oceanfront Resort, and their annual conference and trade show is July 17th through the 19th, 2024, in Orlando, Florida, at the Signia by Hilton Orlando Bonnet Creek.
And the Tennessee Ambulatory Surgery Center Association's annual meeting will be September 12th through the 13th at the Chattanoogan in Chattanooga, Tennessee. And don't forget about our upcoming boot camps. We have the Administrator Boot Camp, which you can register for at ASC-Central.com, and that's going to be January 23rd to the 26th. And that will be done virtually, as well as our Business Office Manager Boot Camp, which will be March 12th through the 15th, 2024. And again, both of those are virtual. They're for their conferences as well as mentoring, and more information about that is available at ASC-Central.com. And don't forget about our Credentialing, Privileging, and Peer Review Conference on January 11th and 12th, 2024, again, virtually. And we'll be updating our 2020 conference on credentialing and adding a lot of new content, particularly in the area of peer review. And again, more information about it is at ASC-Central.com. And don't forget, we also have on-demand versions of our ASC Director of Nursing, ASC Administrators, and our ASC Business Office Manager boot camps. And all that information is also available on ASC-Central.com. And don't forget about our patron member program. And that is for $25 a month to become a patron member of the podcast and get a lot of great benefits, including weekly drop-in sessions, usually weekly drop-in sessions. Right now, they're on Saturday mornings at 10 o'clock Eastern Standard Time. For more information about that, visit ASC-Central.com or ASCPodcast.com. Membership helps to defray the costs of producing the podcast, including our research staff, travel costs to conferences, equipment costs, and production costs. Thank you for joining us for this episode of the ASC Podcast with John Goehle. If you found the episode informative, we encourage you to share it with your friends and colleagues in the ASC industry. And don't forget to hit that subscribe button so you never miss an episode. We'd love any feedback about our episode or ideas for future episodes by sending us an email at comments@ascpodcast.com. And we, of course, want to give a special shout out to all of those people that make this podcast possible. Our sound editor, Susan Cronkite, executive producer, John Goehle, and our dedicated research team, Sue Cronkite, Jenna Alvarez, Judy D'Ambrosio, Alex Borneman, Zach Calritis, Jim Masters, Amy Durbano, Lori Rodricks, Kathy Foti, Donna Macchio, Christina Norman, and Katie Pearson. We certainly couldn't do this without them. Our music is provided by Media Sushi and Mike Noah, and the ASC Podcast with John Goehle is hosted on Podbean and is available on all major podcast platforms. Thanks for listening.
This episode of the ASC Podcast with John Goehle is sponsored by triValence. triValence offers a comprehensive next-generation ASC solution that optimizes payment and supply chain performance, enabling actionable data insights. For more information about triValence, visit their website at trivalence.com. That's trivalence.com. This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.